Hi, my name is Jeremiah Mensah, a student nurse from Cedar Crest College. The topic for my poster presentation is ABCD bundle in the management of delirium. Now, I chose this topic because delirium has become a major concern in the ICU population. This topic is significant to nursing practice because delirium in the ICU affects 60 to 80% of intubated patients and 20 to 50% of non-intubated patients. ICU patients are at risk of lengthy mechanical ventilation, self-extubation, catheter removal, the use of restraints, increased length of stay, rise in hospital costs, and increased mortality. Mechanical ventilation, sedation, and immobilization are also known risk factors for delirium in the ICU. The ABCD bundle is aimed at minimizing sedation, encouraging early ventilator liberation, improving delirium assessment and management, and facilitating early mobilization in the ICU. Now, the cost of managing or treating a delirious patient is estimated at $9,000 per case, which increases the healthcare costs to a range of $6 to $20 billion yearly in the US. That's pretty significant. Now, this led me to ask the clinical questions. In critically ill adults, does the ABC bundle versus usual standard of care decrease the incidence of delirium? My process of literature search included Google Scholar, Embase, PubMed, and CINAHL. These were the database I used. The keywords I used were the ABCD bundle, adult patients, and intensive care unit. This yielded an initial result of 528 articles. Limited factors I used included the year of publication, which is 2009 to present, peer-reviewed research, published in US. It has to be English in English language. The user has to be, it has to focus on the ICU population. I also used exclusion criteria, which included mechanically ventilated patients only, focus on mobility, and focus on application of physical therapy. 8 research articles were identified as strong evidence for the study, of resources for the study. Out of these 8 research articles, 3 were chosen based on their strength and quality. So the first articles that was chosen was done by Ballas et al. The first study was done by Ballas et al. The purpose was to evaluate the effectiveness and safety of implementing the ABCD bundle to everyday practice. The design they used was an 18-month prospective cohort before and after study. The result, they found out that critically ill patients managed with the ABCD bundle spent 3 more days breathing without assistance, experienced less delirium, and were more likely to be mobilized during their ICU stay. The second study was done by Barnes Daly et al. In 2017. Now, the purpose of their study was to find the association between ABCD bundle compliance and patient outcomes, which included hospital survival and delirium-free and coma-free days. The design they used was a prospective cohort quality improvement study. They found out that hospitals which successfully complied with the ABCD bundle had a lower rate and fewer days of delirium and coma. They also found out that the survival rates were higher in those who implemented and complied with the bundle. The last study was done by Barnes et al. In 2016. They hypothesized that the prevalence of duration of delirium will be lower after implementing the ABCD bundle than before. They used this retrospective study design. They concluded that there was significant decrease in prevalence of delirium. They also found out the number of patients who stayed in the ICU without delirium also increased after the implementation. These studies led to the 3 recommendations. The first, which is to consider the type of clientele, their culture, and ICU staffing of individual ICU before implementing the ABCD bundle in the entire ICU. The second recommendation stated that increased randomized control trials targeting non-mechanically ventilated population should be used to reinforce the ABCD bundle. The third recommendation is to explore for future studies advanced study designs to help understand the relations between bundle components, compliance, and outcome. Now, in conclusion, delirium in the ICU is very significant because of poor patient outcome and cost of treatment. ABCD bundle is an effective tool in reducing the incidence of delirium in the ICU. Future studies are required to strengthen the components and compliance. Thank you for watching.